Hi, I'm Helene Figueroa, and I'm going to be showing you a short presentation on vascular malformations. Okay, so we're going to be talking about vascular malformations. What are vascular malformations? Why do these vascular malformations occur? What are the symptoms of a vascular malformation? Diagnosis of vascular malformations, how vascular malformations are treated, and what is the prognosis for a patient with vascular malformations? So, what are vascular malformations? They are congenital vascular anomalies, either of veins, lymph vessels, both veins and lymph vessels, or both arteries and veins. They're present at birth, and they do become apparent at different ages. Malformations interfere with the normal flow of blood. There may be a tangle of veins or arteries that create a malformation that resemble a bunch of grape stems. So why do these vascular malformations occur? Well, they're known as something that occurs during the development of the arteries, veins, and or lymph vessels. And right now there is no known specific cause. They're often seen on physical examination because of the discoloration of the skin or a lump or a hemangioma. But the deeper vascular malformations can be diagnosed using MRI, MRA, and angiogram. Some of the symptoms of vascular malformations are pain, lump under the skin, an overlying birthmark like a hemangioma, discoloration at the site of the malformation, and possible bleeding. Lymphatic malformations tend to become infected and they require repeated antibiotic treatment, and they might even leak lymphatic fluid. Arteriovenous malformations are painful, they're stressful on the heart, they could actually cause heart failure. Again, they do have discoloration at the site of the malformation and possible bleeding. Pulmonary arteriovenous malformations will show up as a symptom with low oxygen, shortness of breath, fatigue, coughing up blood, maybe blood in the chest, and they are an increased risk for stroke or brain abscess. The way that vascular malformations are diagnosed is you could have a sudden event, which would be considered urgent. There'd be bleeding, loss of consciousness, maybe seizures or headaches. You'd be admitted to the ICU and immediate testing would begin. The not so urgent diagnosis would come when you would see maybe something visible on the body, like the discoloration or a lump. Throbbing is felt in that area, so the same testing would begin, but on an outpatient basis. Vascular malformations are treated in a few different ways. The most successful and common one is embolization. It's safest, it's most reliable, and what it does is it blocks the blood flow to the malformation. It's basically used for the arterio and venous malformations, and several different types of embolic agents are used, such as coils, stents, balloons, sclerosing agents, or medical glue. Another way to treat vascular malformations would be through focused radiation, using radiosurgery or a gamma knife, uses a focused beam and seals the malformation. It's very non-invasive, there's no incision or pain, and it does treat malformations that are once considered inoperable. This type of focused radiation can take very long to be completed. There's also neurosurgery. It's not commonly used, but it will remove malformations, but due to the risk of serious bleeding, it's definitely something that they don't usually use. And the other thing that may occur is that there's a variety of treatments used to treat the vascular malformation. So the prognosis of a patient with vascular malformations is pretty good. Venous and lymphatic malformations do respond well to embolic agent introduction treatments that require a series of treatments at 6-week intervals. Arteriovenous malformations are more difficult to treat because they tend to bring in new feeders, and they may require a series of treatments to block all the feeders. Pulmonary arteriovenous malformations are very effectively treated by embolization, and the patient usually sees an immediate improvement in their symptoms because they have increased oxygen levels. But all malformations do require long-term monitoring due to hormonal changes that take place in our bodies that do have an effect on these malformations. I hope you enjoyed that short presentation and found that there was something new to be learned about vascular malformations.